I am Peter Renes, and I want to tell you the little story about I just got an injection in my eye. I had a central vein occlusion, and I've had many injections. Uh, I had some very bad experiences and some very good experience. I'm going to tell you the bad experience, and then at the end I'll tell you the good experience I got. Bad experience is that the first symptoms of this central vein occlusion occurred when I was way down south in the United States, and I went to see an eye doctor, and he gave me an injection, and it was painful. He told me to come back a week or 10 days later, which I did, and it was even more painful. Now, I am a war veteran uh, from the last World War. Almost 90 years old. I've gone through a lot of pain, a lot of scare, but when this third injection was to take place in the United States, southern part of the United States, won't give you any names or don't give any references. They actually called in two helpers to hold my head steady because I was knowing the pain and actually was unbelievable. They had to hold my head steady to get that pain in the eye. Good. So I figured this out. I'd rather lose the eye than having more pain like that. Really. So we came to telling a friend of mine who has who is Canadian here in Canada, and he said, well, he says, let me talk to my eye doctor. And so he did, and he got me an appointment with a Canadian eye doctor. And fine, so I went in to see this fellow. He gave me the treatment. As a matter of fact, he took pictures and did some testing on the eye before he gave me the injection. And all of a sudden he said, look up, and I thought he was going to give me another drop because they was giving me several drops. And I looked in my eye, and and said, so doctor, when are you going to give me injection? He says, I just give you the injection. I said, no, that's not possible, doctor. He says, yes, he is. He showed me the needle. He showed me the injection. Yeah. I could not believe it. Anyway, I've been back and forth here for several times. I just 5 minutes ago, I had another injection. I could not even believe he gave it to me. I just simply could not believe because I simply didn't feel it. Now, 6 weeks ago, 8 weeks ago, I just happened to be way south in another country because I do have travel commitments. And I figured out I'm going to go to my doctor there, to an eye doctor there, and a doctor that had seen me before, an eye doctor. So he went and he said, yes, I can give you this injection. So I checked with the doctor here, what is he injecting? And I told him, he said, yeah, we do the same thing. I said, fine. Well, he prepared me for the injection. It was about 3/4 of an hour. I don't know how many drops he gave me, but it started to look like rain going in the eye. And then finally, when he got to it, he gave me the injection. I can see him come with the needle. It did, I felt it, but it wasn't painful. But apparently, after that, it started to bleed, which never had before. So, and I still, even today, I still had the leftovers of the bleeding. So that was, from my point of view, technically a mix-up. So I have decided that I'm not going to go ever there. I'm not going to go ever back in the southern part of this country. I just traveled 1,600 miles day before yesterday simply to get here because this is going to be the only doctors ever going to look and give me anything in my eye. That's the story I want to tell whoever wants to hear it. That's the story. This is my story, and I stick to it. Now, I tell you, I had to keep my language under control because I am a very outspoken man and I use certain swear words that I'm not to be able to use. But I'll tell you, it was bloody great.